One of the country's leading private hospital groups is encouraging those with compromised immunity who are fully vaccinated to go for an additional shot of the COVID-19 vaccine. Let's speak now to Dr. Louis Kathan, who is a Chief Medical Officer of Life Healthcare, about why this is an additional vaccine and not a booster as such. Good evening, Dr. Kathan, and thank you so much for your time. So I think perhaps so that we just start off on the same page, if you can just clarify what it is that you as physicians are encouraging people to do.
Good evening. Thank you for inviting me to discuss this very important topic. At the end of November 2021, the Department of Health in South Africa released a circular which defined what moderate to severe immunocompromise is. And what they said was that these entail patients who are previous transplant patients, so solid or bone marrow transplant patients, patients on immunotherapy, patients with long-term dialysis, cancer patients on active treatment, and also people who have no spleen called asplenia, and also HIV positive patients with a low CD4 count. These patients are at risk and are more vulnerable to contract COVID, and also these patients are at risk of not mounting a full immune or an effective immune response to the current vaccinations. Therefore, they've decided that these special group of patients, or this special group of patients, would be eligible for an additional vaccination. And the aim of this vaccination is to create adequate antibodies and an adequate immune response.
Dr. Kathan, let's perhaps then talk about the difference between an additional vaccination versus a booster shot.
Okay, so these are indeed different. A booster shot is given in normal immune competent patients. This happens several months after the full vaccination schedule. So as an example, for the Pfizer vaccination, where you've had your 2 vaccinations and now you require an additional 3rd booster shot to increase your antibody and immune status so that you are more effective and can be protected against COVID-19. So we do know after several months that your antibodies do decrease or wane, and the aim of this booster shot is therefore to return you to your original level of effectiveness of your antibodies and immune system, and also to extend the length of protection against COVID-19.
So
whereas,
sure, you can continue. Yeah.
Whereas the additional shot, as I said earlier, is in immune-compromised patients to improve their immune status, because we know that potentially immune-compromised patients do not mount an adequate immune response after the current vaccination schedule.
Does it matter, very briefly for me, Dr. Kathan, when people actually go for this vaccination?
So the guidance on when, if you read the circular, says 1 to 3 months after your second Pfizer vaccination, as an example, or your Johnson & Johnson vaccination. But the length of time needs to be determined by your primary care practitioner, so your doctor or your specialist, or otherwise your nurse care practitioner. So someone that's guiding and leading your medical therapy. So in our institutions at Life Healthcare, we've got a big renal dialysis units, and we also, or network, we also have oncology networks, and we've been actively advising these compromised patients to go for the additional vaccination.
Dr. Louis Kathan, let me thank you so much for your time. He is with the Life Healthcare and is the Chief Medical Officer there.